Hi, everyone. It's Nancy, the nurse practitioner here from Caregiver Success. I hope you're having a great day. I have a special guest for you today. Somebody from my past. Love this gal. We're nurse practitioners. We've known each other. Boy, her name is Teresa Imperiale-Westerfield. She works in Melbourne, Florida, as a specialist in
Ter-
osteoporosis.
Teresa.
Oh, thank you, Teresa. I like that even better. I never do that. Yeah, there's no H, so it's Teresa if there's an H, and Teresa
Yeah.
if there's no H.
Yes.
Okay. All right, so Teresa, I like that even. I do. I like that. So we've known each other for many years. You kind of stumble into each other through our careers, and we caught up. And she's working in osteoporosis, and the baby boomers out there, the older people out there, and we're going to talk about my situation in a little while. But you guys can all relate because once we hit menopause as women, we already either have our bones for life that may stay where they are, or they might start dissipating if we don't stay there. And Teresa is going to tell us all about that. But we're going to just go into some questions here. The first question everyone needs to know is who should get a bone density test? So Teresa, tell us who should get one.
Um, According to the World Health Organization, it's women over 60 and men over the age of 70. However, if somebody has a fracture where they've fallen from their standing height, they should get a bone density no matter how old they are,
Hmm.
because that's considered a fragility fracture, and that is not a correct thing. That is not something that would be expected. And so there's a problem and it needs to be identified.
So can I just say something? My good friend Lola's sister fell in her garden. She's 70, broke both of her wrists, had to have two rods put in one arm and a rod in the other one, and just from falling over. And that was my first question to her. And she says, "Oh, yeah, she's had her bone densities." And I'm like, hmm. So how about that? Because we are afraid of falling even in our gardens, which is a nice thing to do. If she had a bone density and it was normal, but she broke all these bones.
That can happen. So interpretation is a huge thing. A
Hmm.
lot of people don't, most providers don't understand how to interpret the results of a bone density. What I see is a lot of patients who are considered to be mildly osteopenic or have normal bone densities, but the providers don't understand that you need to look at all the numbers that are reported on the bone density, not just the report from the radiologists.
Mhm.
Sometimes there's numbers hidden in there that you don't understand, that will tell you that the patient has osteoporosis, but you're not seeing it because you're getting the report from the radiologist is an average number. It's not all the numbers, and all you need is one place to be below a minus 2.5. I had
Hmm.
a patient yesterday who's had numerous fractures from falling. She had a patella fracture, an ankle fracture, and a skull fracture, and just falling from her standing height. And she had one score of minus 2.6. Everything else looked osteopenic or normal. So the fact that she's had three fractures tells me she's got osteoporosis,
Hmm.
but there was only one score, and I expected it to be far worse.
Wow.
So the bone density is a guideline, but you have to look at your patient and see what's going on.
Hmm.
It's also important then, if the bone density is not so bad, is to do other diagnostic tests. And, I have a whole panel of blood work that I do to make sure I'm not missing anything like hyperparathyroidism, or in a male patient, low testosterone. Maybe their vitamin D level is so low that it makes it, they're not absorbing any calcium, and that could cause fracture.
Hmm.
So there's lots that go into it besides just that bone density.
So that's another interesting thing. I'm nosy everywhere I go, and I went to visit one of my old patients' wives, and he had died years ago. And she's 93 years old. She's a little Asian petite woman, and she's a little unsteady on her feet, lives alone. And I'm visiting for tea and a sandwich. And of course, I do my nurse practitioner house call thing, like, what, you still climb the stairs to go up to bedroom at night by yourself. You don't have a life alert on, or any kind of phone. She had a bone density 20 years ago, doesn't believe in drugs. I think she was put on something back then, she said, and she didn't do well. So she said, I don't take anything. And I'm like, you mean no calcium, no vitamin D? So it's like she wants to be as independent as she can at 93. She is so smart, and she drives and all that. But I think what I tell her is you want to be independent. And she says, I don't want to go there, Nancy. I'm like, you are one fall from like a nursing home. And I don't, and
Yeah, yeah,
I'm like,
absolutely.
she doesn't want to call anybody. I'm like, that is it. So I texted her yesterday about getting on some calcium citrate 3 times a day. And because she eats well, but I told her, even our food is and our nutrition is soil depleted now. So you're not getting everything from those green leafy vegetables that I've been told, and even
Well,
low
so
fat yogurt, you
the
know.
problem with the green leafy vegetables is,
Oh,
especially like years ago, I used to tell my patients, eat a spinach salad every day, eat broccoli. However, that we found since then that the antioxidants in those two particular products, those particular vegetables, stops you from absorbing the calcium in them, the
oh, wow.
antioxidants.
Well, I
I
know
know, right?
kale. You mean like
So
spinach? Spinach? Like putting it in a
spinach and broccoli. Don't even bother. I mean, they're good for you. You get iron in spinach, and they're good for you. They're good for the fiber, but don't count on them for calcium.
oh my
Okra is
God.
okra is a good thing for calcium. Arugula is a good thing for calcium. They don't have the antioxidants. Kale's a good thing for calcium, but not spinach and broccoli, which just totally blew me away when I heard that about 10 years ago.
But I have
So
to add about the kale. I was eating a lot of kale because we had tons in the garden. So all of the summer I was kale overdosing. And
good.
then for my physical, and my thyroid was off.
Huh.
It never had been off. It was really off. And I'm like, why do I have this? And I looked up, the only thing I did differently in the last 3 months is kale. And I got rid of the kale because it screwed up my thyroid. So
So did you retest and see if it got better?
I did.
And
I
it got better.
did. And see, so see where that goes? Because if my thyroid is off, then my bones might have been starting to have trouble. So, we all have to kind of like take this dance with our eating and our supplementation.
Yeah. And
You
for
don't know what
somebody like
works.
your friend,
Mm,
she's you had indicated that she was a small woman, Asian
Asian.
woman. So she's at highest risk for osteoporosis. And she's at her age, since she's had no treatment, she's at very high risk for breaking a hip if, God forbid, she falls. So
Hmm.
she's like a really important person to get treatment for this condition.
And
And
she,
there's so
yeah.
many options now.
Okay, so and I told her about Helen Hayes Hospital. Everybody, I live in Connecticut, but in New York, there's this beautiful, wonderful Helen Hayes Hospital osteoporosis clinic that when I remember starting to practice, was just getting off the ground, and now it's 30 years later, and it's like the go-to place. And she lives in New York, near this place. And
Yeah,
I
so
would
she
have to do a
should.
driver there myself because she's like this little Asian woman, like, I got this, Nancy. I read the New York Times every day. And I'm like, well,
Yeah, that.
you know,
So never believe everything you read and only half of what you see, right? There's so much misinformation out there. It just drives me absolutely crazy.
well, I remember I did do a YouTube video a while back on osteoporosis, and I showed people the spectrum. Like, here's zero, and here's the positive numbers. And if you're underneath these numbers where you get into the negatives to the 1.5 to the 2.5, so people can actually see what that means every year as they look at their bone density. And that's another thing. I moved to Connecticut from New York, and all those bone densities were in New York. And the first one when I got to Connecticut showed that I had osteopenia when I never did before at the New York ones. So tell us about different testing at different sites.
Well, the optimal thing is to get the test done in the same site on the same machine with the same with the same technician. That's not always possible. People
No,
move, you know.
no.
So if you go from, say, a GE Lunar to a hologic machine, there's variations in how they read your bones. But there are charts out there to compare. So
Mm,
to do an equivalency, you
mm.
can't, a provider can do that. People don't know that though. And they don't, primary care doesn't have the time to do all this.
No,
OBGYN doesn't have the time to do all this, you
I know
know.
that. So now that I had a bone density that showed this, my doctor said, let's do a vitamin D level on you, which was part of my physical in January. And I had my bone density, it was osteopenia, but like a point, like a zero, negative 0.2, I think I was.
That's normal.
No. Yeah, I know. And then it was diagnosed as like I'm starting to get penic. It wasn't
Oh,
1.5, it was, I'll have to show you the results. And then he did a D, which I asked, which actually Medicare, I'm on Medicare, would not pay for it, which is the other thing. But I went to Quest, which does do my labs, and I did have to pay $15 for just that vitamin D. It used to be $250 for that vitamin D test.
oh yeah.
Yes, because insurance does not think that it's a necessary test because it's a vitamin test. And
It's well, it's not all insurances, but it's gotten better over the years. It's gotten much better.
okay, but he
Um,
wants me to have another bone density. And you were saying that you're only allowed one a year.
one every 2 years,
But
unless they can prove medical necessity.
okay, so I'm not doing the
However,
chemo. My blood work is okay. My vitamin D came up to 48 from
good.
28. I'll
So
just,
you're still taking vitamin D, right?
yeah, I'm still taking, I always was.
Okay.
Not, maybe it was the
Did
winter,
you
and then I just
increase
really,
your dose?
I did not. I did not.
So don't take what you were taking before because that's what got you low. You need to increase your dose
But
to
that,
in
but
order to maintain where you want to be.
but the thing is I'm doing the same as I did, and it's up to 48 now. So something else must have, something else. It's just, it was Quest, so there's the same. I don't know. I'm gonna just ride it out for 6 months, keep on the D because the level was good. Um, right? And I can't do
Yeah.
another bone density yet because
Well, so here's the thing. Insurance only pays for it every 2 years unless you can prove medical necessity. However, it's a very inexpensive test. It used to be a very expensive test. Now it's very inexpensive. I don't know what it costs up there, but I know here in Florida at the place I like my patients to go, Atlantis Diagnostics in Melbourne, Florida. They do a thorough exam, but they're only charging like $50.
okay.
So
That's
my patients are saying it's worth it to me to spend the
absolutely.
$50 to get that information that I need after a year. So
Okay.
if a patient, if you can afford that or find out what the self-pay rate is so that you can get the information sooner. But I wouldn't recommend 6 months. I would recommend a year.
Okay. And some doctors I know, they're very on top of you, and which is really good, but sometimes it's too zealous on my part. And I like to kind of peel my onion, like I did my patients. Let's peel them down and say, what do we need to do to get to this point? And I'll see you later and we'll go back there. So it is part of critical thinking as a clinician, like, what's the best thing for my patient? She's eating
Right.
kale. She figured that out. We stop the kale. The thyroid goes back to normal. I mean, you almost have to be your own advocate in a way.
Yeah.
Is that a weird thing? But so,
No, no.
yeah. So calcium and vitamin D, we'll move on to the questions. How much should we take? Tell me more about the calcium and vitamin D.
So I know that, according to the World Health Organization guidelines, National Bone Health and Osteoporosis Foundation guidelines, everybody's saying like 1,200 milligrams of calcium and 800 units of D. I
Mhm.
don't find that adequate for my patients. I've been doing this for 22 years. In most cases, not all, but most cases, I'll have my patients make sure they get 1,500 milligrams of calcium through diet, mostly diet and supplementation. If they could do it all through their diet, even better, because you absorb it more efficiently. And I recommend for most people 2,000 units of vitamin D a day. I find that that keeps them at a normal level. I like my patients, their vitamin D levels between 40 and 60. Even if they go up to 70, I'm fine with that.
Mhm.
But I find that those recommendations I found over the years work really well
So when
for
people say, when you
most of.
say eat your calcium, I mean, I love sardines. I know they're loaded with
Yeah,
calcium, but
sardines.
yeah, tell us what's loaded with calcium to help people.
So there's a couple of products I recommend for my patients pretty regularly. One is almond milk. So
Mm.
some people don't like almond milk, but God, I got to, and this is a plug, um, not for the company, but I have no relationship with either of these companies, but I've, they taste good. So Almond Breeze makes a chocolate almond milk. It's only 100 calories, but it's got 450 milligrams of calcium. I mean, Silk makes similar, but it doesn't taste as good to me anyway, and to my grandkids.
Is
So
that
I
a
always
cup?
recommend that if they like the almond milk, to go for the almond milk.
Is that a
The
cup of,
other,
I'm sorry, is that a cup of that a day?
yeah, a cup
450?
of almond milk.
Okay.
And then the other thing that got me really excited, one of my patients' husbands told me last year about Yoplait is making, they have this protein yogurt. They call it protein yogurt.
Mm-hmm.
And a small cup, those little servings of the Yoplait protein yogurt gives you 430 milligrams of calcium in it. How
Wow.
easy is that? So
Yeah.
right there between both those just two simple little things, you
Hmm.
have 880 milligrams of calcium. There's more than half of what you need for the day. So
Yeah.
how, to me, that's exciting. So I always recommend those to my patients on a regular basis if they like yogurt and if they like the almond milk.
So what if they're not, like, let's say they're lactose intolerant and they just can't go there? What would you?
Um, well, the almond milk doesn't have lactose in it. Lactate makes a calcium enriched. They call it calcium enriched.
Okay.
Um, and I believe that is 500 milligrams of calcium in it, if I'm not mistaken.
Okay. And what about food besides the milk products?
Um, I calcium enriched orange juice, 8 ounces gives you 350 milligrams. Arugula is a good option. 6 ounces of arugula will give you 160 milligrams. Um, Raisins and are packed with calcium.
Cool.
Um,
Didn't know that.
yeah.
And
Uh,
sardines, if you like them, I know they're, how much?
Sardines are packed. Canned salmon. Canned salmon is packed with calcium. So there's a lot of things out there. If you start looking,
Yeah.
there's a million lists out there with foods that are high in calcium that
People
you
can
can get
Google that.
on.
Everybody knows they can Google what can I eat high in calcium and just go
Right.
for it. Okay, that's good. And the D, it has to be D3, correct? Not
Yeah. So here's
three.
my thing about D. And here's my thing. I got two things about, one is about D and one is about
Okay.
supplements. The big thing right now is I don't know where this marketing stuff came out, is to take vitamin D3 with K2 in it.
Mm.
Now, you and I both know that vitamin K thickens your blood, right? It's an antidote to Coumadin overdose or to warfarin overdose, right? When patients, INRs or PTs, go too high and their blood gets too thin, we give them vitamin K to
Mm.
thicken their blood.
Right.
So if you don't need your blood thickened and you start taking a lot of vitamin K, there's some vitamin K in our foods. So uh, don't take extra vitamin K. I think it could be dangerous.
Okay.
And
Good
I've
point.
done a lot of research on this since this came out, and it's just, it's a marketing ploy. Oh, do this. The
Mm.
other thing that drives me crazy is strontium.
Hmm.
So strontium rallinate has been banned in Europe. But there is a plant-based strontium, but still that's not banned in Europe. And both are readily available in this country. But what strontium does is it's a mineral that lays in your bones, and it actually fools the bone density machine into thinking your bones are stronger. They're not.
Oh,
The machine is picking up the strontium.
got it.
And um,
Oh man, too many variables here. How do you
right.
know?
So no strontium, no vitamin K.
Gotcha.
That's my advice.
Okay, those are big tips, everybody, right? I mean, let's just start with what we can do quickly is just don't go there. And you're right, in our diet, there's a mishmash of things in everything we eat sometimes. And if you could, if and the other thing about varied eating, everyone, we have to have a variety of foods. We have to move around. Some people get up every day and eat the same thing every single day. And that sometimes gets us in trouble without us even realizing it. So we need to like have a varied diet with a colorful plate, and it's still the same as it was 30, 40 years ago. Although I do admit that I think our nutritional we're working on the food pyramid kind of thing, that was a little
Yeah,
all these years and people were getting kind of big. And I
yeah,
was just in
yeah,
Europe and everybody's skinny. And I'm
yeah.
looking at food labels, and even the potato chips don't use canola oil and salt. And no, there's definitely no sugar. But if you look in our potato chips, even there's sugar.
Right.
Like there's so much stuff in our products that I'm so glad we're kind of cleaning that up because you can't stay healthy if you eat like this.
Oh, correct. Correct. So yeah, I'm glad things are,
Kind of turning around. Yeah,
yeah, yeah, I really am. I'm really happy to hear that.
me too. So we have we just, no, let me just take this off. Sorry. Just looking at, we have 10 minutes left. So we still have a few more questions, everybody, that we need to hear from Teresa. Treatment options and why.
So there's lots of treatment options. Um, there's the oral bisphosphonates that everybody knows, Fosamax, which is alendronate, ibandronate, which is Boniva, and then risedronate, which used to be Actonel, is now Atelvia. All those options are out there.
Mhm.
Generally, with the orals, I'm not a fan of Fosamax or alendronate at all. I will not prescribe that for my patients because it has a 10-year half-life.
Mhm.
So it can build up in your bone and it can cause a lot of bad things, such as osteonecrosis of the jaw, atypical femoral fractures.
Mhm.
The risk of that is a lot less with ibandronate, with has a half-life of 17 days. So it takes only 17 days to clear it out of your system. But
Mhm.
then the rest of the month, you're getting no medicine. So risedronase, honestly, in my book, after all the research I've done, is the best product. It's 28 days. You take it every month or every week, and it works the best. But the best you can hope for with the orals is to stay where you are. So I use orals once I get patients to a point where they don't need the big guns.
So what is the brand name for that one? Just so I can tell
With
everybody. For the rest.
risedronate is Atelvia, but most insurances won't let you have the Atelvia.
Gotcha.
They'll
Gotcha.
let you have the risedronate. The other options are Prolia, which is an injection you get every 6 months, which is usually extremely safe. I've had maybe one patient in 15 years with side effects on that medication. And then there's your anabolics, which are Forteo or teriparatide,
Yeah.
Timlos or abaloparatide. Those types of medicines work a little bit differently, but they're still very effective. But they're short-term treatments. And then you need to do something else afterwards. And then the biggest guns we have is Evenity. And Evenity does what Forteo and Timlos does, but it also does what Prolia does at the same time. But that's only good for a year. But I've gotten big improvements in bone density with that medication. So I use that for my patients with severe osteoporosis.
Is it IV or is it
It's an injection you get once a month for 12 months.
monthly?
Then
So,
there's
okay.
reclast is the IV or zoledronic acid. That's once a year.
Mm-hmm.
Um, People can have side effects from that though, and you shouldn't be on it for more than 5 years like the oral. So,
Mm-hmm. And
so it's a lot. It's a lot. But now we have options. When I started doing this 22 years ago, we
yeah,
had hardly any options. So
I
this is
remember that.
wonderful.
I didn't even some of the names you're mentioning. I mean, I remember the Prolia and the Reclass and the Fosamax, of course. But you're right, Evenity. So I guess my question, because here we go again with the cost of medication, but I need it. Is that an expensive drug? How does that get covered?
So if you have Medicare and a secondary
Mhm.
that's not Medicaid, Evenity's covered. It's not a problem,
Cool.
as is Prolia. Um,
Okay. Okay.
if
Good.
you, but unfortunately, Evenity can, with Medicaid, it is not covered. But or if somebody doesn't have insurance or their insurance denies it.
Mhm.
However, and it's a very expensive medication. However, I was just educated on Monday by our district sales rep for that product that there are monies for people who are don't have health insurance or are underinsured. So there are monies available to make sure that people get the product.
So in other words,
It takes a little work on the provider's part, but it's worth it in my book.
okay, so it's almost like a coupon or a discount program where you can.
It's
Mhm.
they pay for the medication,
Gotcha.
so that
And
kind of thing.
I know about that because we have someone on Humira and she can't afford it in our family, and she's on this plan, and for $5 a month instead of 5,000 a month, she gets her Humira
Right,
because so
right,
she can't
right,
afford it.
right,
So it can be a good thing to definitely be. I got to tell you guys, it's so important to be an advocate for yourself. Don't just let it go and say, I can't afford it and walk away. Ask questions, go online, look up the drug yourself, go to the company. If you can't do all that, let your daughter or your son help you, somebody who's great on the computer. Advocacy gets you a long way. You're not being the greasy, wheel kind of thing. You're just saying, this is what I need. How do I get it? Uh, uh,
right,
and let's go there. So I just want to mention
right.
to you, advocate big time.
Yeah, yeah.
And
That's very important.
it is so important. And now one more thing before we run out of time is I really worry about May, my friend, because she says, I have a 91-year-old sister in Europe, in Holland, same build, Asian, all that. And she says, well, she's never had a bone density in Europe. There's not very much preventative care. So I don't even have myself to compare her to, but she says, well, our genetics are wonderful. We were all slight people. I get worried because sometimes people put themselves in this safety box, like nothing's going to happen to me. Um, and she walks out to the car and greet me, and I'm like, I hope tomorrow she can do that. You know what
Right,
I mean?
right.
So I'm
No,
just,
it's important. So,
yeah.
and the other things that are really important is exercise, walking at least 20 minutes per day, like intentional walking and stepping. A lot of patients like to do Zumba or things like that. And then the other option that's out there that you can help in addition to the calcium and vitamin D is collagen peptides. Collagen peptides, there's been numerous studies that show that it helps build bone, and collagen peptides really are great. However, there's a caveat with collagen peptides. If you're a woman who's had a mammogram and shows that you have densities in your breasts, you should not take collagen peptides because can make the densities worse and also can then have them turn into, there's a potential to have an increased risk of breast cancer. So I don't recommend collagen peptides if somebody has densities
Where do
in
you
their
get the
breast.
collagen peptide? Where is that? What do
I
you,
get mine online. I get them I get it on Amazon. It's called Purely Inspired, and I do a scoop a day in my coffee,
gotcha.
and it helps build bone. It helps your skin. It does a lot
That's,
of great
that's
things.
something May might do, but I don't know anything about the
She
rest.
might be willing to do that, yeah.
Yeah,
But
she.
again, you got to be careful because of the if she's got dense breasts, then she wouldn't want to go on that.
Okay, so we have a couple minutes left and we want to get to the last question. Besides that, how about weight bearing as far as walking with weights, jumping up and down if you can, or what else can you do?
Well, you might not want to jump up and down depending on your T-scores and your
Absolutely.
lumbar
No,
spine. If you have severe osteoporosis or any compression fractures in your
of
spine, do
course.
not jump up and down.
Right.
Dancing, walking. If you weigh less than 127 pounds, you can walk with ankle weights or a weighted vest. Sometimes my patients can't afford that, so I tell them to put a backpack on and put a bunch of cans of soup in there or to increase their weight. I had one patient who used to walk around her neighborhood all the time with a backpack full of cans,
That's a great
and
idea. It's a great.
somebody thought she was a homeless person.
Oh,
She was like, I can't tell you what happened to me. I got to tell you what happened. She's like, somebody stopped me. They
one
thought I
minute
was
left.
homeless.
We have 1 minute left. Oh my God. Well, what if we don't treat this? What happens, Teresa? What if we
Your
don't
risk
treat it?
of breaking a bone if you fall are very high. And if you break your hip,
Mm.
as a woman, you have a 20% chance of dying within 1 year, and your life will never be the same, even if you don't.
And
If
you
you're a man, you
suffer.
have
And you suffer.
30% chance of dying within 1 year from complications.
And you don't, you
So
go to nursing homes and bed sores and all sorts of things happen. It's a
it gets
really
terrible.
downfall.
Yeah.
So
So
yeah.
treating it is very important. Reversing it's very important.
Okay. Any other takeaway? We have, I'm just going to say,
No,
Teresa, this is wonderful. If there's anything else you want to do another video. If there's more we can add, if people answer our questions and ask us things on my YouTube channel, Caregiver
sure.
Success,
I'd
we'll
be
be
happy to
there
do it
for
again.
them. And how do we find you, Teresa? Or how do people find a good place for bone density?